today we have Joe as our patient for the day. We will be targeting 3,000 to 3,500 grafts to reinforce zone 1 and zone 2. I also want to introduce my brother, Dr. George, who also has joined the practice.
Hello.
And he has joined the LA FUE hair clinic team, and he's been doing hair restoration as well. So for Joe, we're going to target, as I mentioned, first half of the scalp. We're going to target roughly around anywhere from 3,000 to 3,500 grafts. He's never had any prior procedures in the past. Are you excited?
Oh yeah, I'm ready.
You're ready? How long have you been wanting to do this for?
It's been a while, but finally I got myself in, so.
Okay,
yeah.
good,
Very
awesome. So what we're gonna do now, Joe, is we're going to clip the donor region. As you know, the procedure has 4 phases. What we're gonna do now is start the harvesting phase.
Okay.
So this next 2.5 hours, we're gonna target the 3,000 to 3,500 grafts. Few seconds of pokes on the right and the left temple. The rest is very straightforward.
Okay.
All right.
That's good.
Bring your chin forward. Now, certain areas of your donor region is not as strong. For example, the right temple, but the back occipital region is actually pretty good.
Okay.
And we actually asked you to color your hair yesterday just because you had some salt and peppers. So this way we get to see the better quality grafts.
Did I do the job right?
You missed a few spots.
Oh, I did? Okay.
You get an A-.
That's good. It looks great.
By the way, first time I go bald, I've never done that.
First time for everything. Is this black or did you dye it brown? It looks like it's dark brown.
Dark brown, yeah, not black. But I've let it in for quite a bit. It goes darker.
So a marker, please. So what we're going to do now, Joe, is we're going to outline your donor region, and we're going to break down the squares, the grid, into equal squares all around. So we harvest the same number of grafts per square, okay?
Okay.
Bring your chin forward a bit. Perfect. All right, Joe, what I'm going to do next is I'm going to disinfect your scalp.
Okay.
Okay, we're going to clean the skin. A little chilly, apologies. It's cold, isn't it?
Yeah, a little bit.
It wakes you up.
That's okay.
All right, let's have gums. Let's have fresh gloves, please. All right, Joe. So this is the part where you're gonna feel a little vibration in the back of your neck, okay? And we're gonna start the numbing process. Bring your chin a bit forward, chin to chest a bit. So this is the worst part for this phase. I always tell clients 3 to 4 seconds on the right temple, 3 to 4 seconds on the left temple, okay? Take a deep breath for me. And on the count of 3, here we go. Apologies. 1, 2, and 3. Almost done. 3, 2, and 1. You did great. This bottom right is all done. How bad was that, Joe?
It's okay.
It's okay? Bearable?
Bearable.
Okay. And here comes the top portion. This is the worst part, like I mentioned. Here we go. 1, 2, 3. Almost done. 3, 2, and 1. You did it. Good job. All done. This right side is all set. Good job.
Let's give you a quick break, Cinches.
Some distraction. Alright. What we did on the right, we have to do the same on the left as well, okay?
Go for
Left side is much smaller than the right.
it. Now
You're
I
doing
know I'm
fantastic.
expecting, so.
Bring your chin here forward. Here we go. 1, 2, 3. Almost done. 3, 2, and 1. You did it. Good job. Now we have the top portion. 1, 2, 3. Almost done. 3, 2, and 1. Good job, Joe. All done. That was the worst. It's all done.
Yep.
Let's have a marker, please, one more time. Let's outline the donor. Bring your chin forward. So one thing I want to let you know, Joe, is this numbing agent that I just gave you has a single drop of epi, also known as adrenaline. It will probably make your heartbeat thump a little bit stronger, okay? If that does happen, it's not you feeling anxious or nervous, it's the medication. And the reason why we use it is so you don't bleed as much during this phase. The rest is super easy. Alrighty, good job. You did fantastic. Any pain, Joe?
Oh,
Any pain?
no pain, no.
No pain. Good. Beautiful. We're almost done, buddy, okay?
No problem.
How you doing, Joe? We're almost done, okay?
No problem.
You have a lot of salt and pepper hairs. These follicles right here that we see,
Eventually, I'm gonna go salt and pepper, so.
yeah. Some are white, some are his natural color, which is, I believe, dark brown. So it almost looks like there isn't a graft in the follicle hair, but it's actually white. They're popping out very easily. can almost use a single forceps. Beautiful. All right,
All
Joe.
right.
First
Everything.
phase is over. The
Yeah.
harvesting takes the longest.
Thank you.
Oh,
Everything was
pleasure.
painless actually.
Okay, good.
Thanks for.
Except for the needle pokes, right?
Well, you at least you prepared. You prepped me, so I was
Okay.
expecting it, so it wasn't that.
Was it better than you thought or worse than you thought?
Actually, much better than I thought.
Okay, good.
I wish
So-
I did it earlier.
Yeah. So, as you know, the procedure has 4 phases.
Yeah.
This first phase, which is the harvesting, took a little bit longer just because, as we had talked about, your donor wasn't above average strong. So we had to really take our time and really pick and choose the grafts.
Okay.
So we're usually a little bit faster with the harvesting phase for this, but for you, we had to slow down just because of the donor strength that you had. Okay, so what we're gonna do now is we're going to get a count of how many singles, how many doubles, how many triples
Okay.
that we're gonna get. So this is, of course, everyone gets a different outcome depending on their donor strength.
Okay.
Okay, Floor? How many total did we achieve? How many grafts?
We have a total of 3,162 grafts.
Okay, so almost 3,200. We were aiming between 3,000, 3,500.
Yeah.
Okay, so it's a good balance. And how many triples do we have? How many singles and how many doubles?
So for singles, we have 1,173.
Okay,
Doubles, we have 1,296.
okay,
And triples, we have 693.
okay. So I always like to have more triples than doubles.
Oh, okay.
Because that's what's really going to give you or a client the most amount of density. But going in, we knew that the donor wasn't, like I mentioned,
Right.
the strongest, but it would be definitely an improvement of what you have.
Okay.
And I always tell every client is just because you have 3,000 grafts or 3,200 grafts, that doesn't mean you're getting 3,200 hairs.
I see.
Depending on the strength of your donor and the percentages, that could yield 4,000 hairs or it could yield over 10,000.
I see.
And this is why everyone gets a different outcome when it comes to hair restoration.
So the triple gives you
The more
better
density.
more than
Yeah.
Okay.
Absolutely. By the way, guys, this is our new YouTube channel. So if you guys were following us on the old one, feel free to follow us on this new one. Don't forget to subscribe. And our new Instagram page also, before I forget, is la.fue.hair.clinic. So, ready for the design?
Anytime.
All right, here we go. So we're gonna disinfect the scalp first. And then I'll take that pencil from you, Floor. And we will get
By the way, anyone watching, if you're thinking twice, just go for it.
otherwise it'll be like you, right?
Yeah.
Postpone.
I postponed it twice, and now that I'm going through it, I said I wish I did it from day one and not postpone it.
Awesome. Thanks for giving your testimony. All right.
Nah, it's the truth.
All right, Joe, we're gonna do the design. We're gonna take a few facial measurements and try and come up where the perfect location for the hairline for you specifically should be and can be, okay?
Okay.
So let's measure the distance from your chin to eyebrow. You are almost 15 centimeters. Ideal location would be half of that number, anywhere from 7.25 to 7.5. So this would be it. Ideally, to break down your face into an equal balance. If I could please have a mirror. Joe, I'm going to show you the mirror. Take a look at this. So ideally, if we had an infinite number of grafts, this would have given you that equal perfect proportion for that new location of a hairline.
I understand.
But for you, because you have thinning all across 4 zones, we can't be as aggressive. We're gonna have to keep a higher hairline, because the higher we keep a hairline, the more coverage you get. Especially considering the limitations of your donor, we can't be as aggressive.
Okay.
So ideally, I would have wanted to place a hairline here, but it's not gonna look natural, it's gonna look incomplete, it won't blend in as well. Versus we keep a higher hairline, then it's gonna cover more of the scalp. Sounds good? So
Okay.
we're gonna do a few options
Okay.
and see what's gonna look good. Alright, I could please have this. Alcohol. Alright, turn slightly towards me, raise the eyebrows a bit, relax it. Alright, so we'll do a few options. No, don't like this. So I think the goal for you, Joe, should be not to really change your look, just reinforce it. Improve what you had. This way. Not bad. Let's do something different on this left side. Turn slightly this way, a little bit more. Look down a bit. I actually like both sides pretty good. Let's measure the surface area. 1, 2. Alright, Joe, I think we got what we're looking for. Okay. So, like we did the measurements, on your left side, you have almost 1 centimeter more loss than you do on the right side. Your distance from the center of the forehead to your right temple is almost 7 centimeters. Left side is almost 8.
8, I see.
So, do you sleep on your left side? Both? Okay.
Yeah.
So typically, clients that sleep on one side, they typically have a little bit more loss.
I see.
But what this causes is the hairline that we just drew right now to be asymmetrical.
I see.
We don't want it to be too perfect.
Okay.
We don't want the right and the left to look 100% the same. We want it to look about 95%. Anything that's too perfect, too straight, right and the left identical is going to look man-made.
Right.
And we're purposely still going to place these little softeners in the very front of the hairline to give it more of an irregular look as well.
I see.
Okay, have you seen your hairline? Did you want me to show you?
Okay.
Tell me what you think, Joe. Take a look. Do you want a widow's peak in the front a little bit?
Whatever.
Have you had one before? What do you think? What are your thoughts? You like it?
I like it.
All right. You approve?
I approve.
Alrighty. So let's take a marker. We're going to break down the zones. Bring your chin forward a bit. Beautiful. So we're breaking down your zone 1. Zone 1 is the first 2 centimeters, okay? This is going to take double the density versus what you have in your zone 2. Zone 2 is the following 5. And the benefit of giving you this higher hairline is you get more coverage in the back. Okay.
Okay.
All right. So let's give you the mirror. So take a look. And this is why we don't really shave the hairs all at once in the morning, is so we get to outline the areas that could use more reinforcement and we could highlight them.
Nice.
So all of your zone 1, which is the first 2 centimeters, are going to need complete restoration. All of this is going to be filled. All of this is going to be filled, including the hairline. Now, all of this here, the triples and the doubles are going to take most of zone 1,
Okay.
because your zone 2 is actually the strongest compared to your zone 1.
Okay.
So what we want to do is we want to put singles for the hairline, because that's all we could only use, or we should use, to give you that soft, natural transition into density behind the hairline, which all the triples and the doubles should be going.
Okay.
But the hairline itself should be all singles, followed by the triples and the doubles. And in your zone 2, you did have over 1,000 grafts of singles. About 400 to 500 is going to go on the hairline. The additional 500-600 is going to go here in the middle of zone 2, which is the strongest. So this should be nice and full as well.
Okay.
Okay. Zone 1 takes double the density. Zone 2 takes half the density we use for zone 1, because we cannot do the entire scalp all at full natural density. A client will not have anything left on the donor region. Does that make sense?
Yes.
All right, awesome. So what I'm going to do now is I'm going to outline this temporary pencil with the surgical marker, and we're going to start the next phase. You are technically more than halfway done.
Fantastic.
So this next phase is going to take about an hour, hour and a half. It's the incisions.
Okay.
We're going to follow your natural angles and directions.
Okay.
So for you, we don't really have too much of angles and directionality to follow. We would have to recreate it. I will follow what you have here.
Okay.
Does that make sense?
Perfect.
Awesome. All right. Joe, what we're going to do for you is we're also going to do PRP. Okay?
Okay.
Platelet-rich plasma.
Okay.
That's going to help with recovery, sooner growth, and it's help bring up the survival rate of the grafts as well. When was the last time you had your head shaved?
Never.
Never? You never had your head shaved?
Never actually. I mean, I went short, really short on the sides, but I never had a shave.
Just like this way. So the whole goal for you, Joe, was not to really change your look, but to improve and solidify what you had. Beautiful. I love it. Looks very good. Yeah. Based on the number of grafts we were able to harvest, I think this is the safest location. Ideally, I would have loved to drop the hairline, because I know a lot of viewers are going to say, why isn't the hairline lower? Well,
Yeah,
every 1 centimeter we drop, it's going to do about 1,100 grafts.
1100 grafts.
So the higher we keep a hairline, the more coverage you get. And this is the best for clients who have a limited donor, not the strongest donor.
Okay.
Does that kind of make sense?
Yes.
And now what I'm doing is I'm placing these zigzag dots to create the look that the hairline's not too perfectly straight, because that's not something that we want. There you go. Let me see. Love it. Love it, absolutely love it. That's the temple. So what we want to also do is we want to bring this hairline, drop it, and connect it to the temple. This is called the temple angle closure. This is what's going to frame your face, okay? What we don't want is just a hairline that kind of goes back. We want to drop it, connect it to your temples. All right, my friend. You are technically more than halfway done. Next hour or so, you're gonna be 75%, and then we're gonna break for lunch after this phase, okay?
Okay.
So, what I'm doing now is I'm disinfecting the eyebrows. We have to numb the scalp, and the way it's done is we have to numb the supraorbital and supratrochlear nerves. That's gonna numb 75% of the scalp. So, this is the worst part for this phase, okay? You're gonna feel 2 seconds right here, a second, a second, a second, and a second. You're also gonna feel a little vibration device on the forehead. There you go. Don't make any sudden movements, Joe. We don't want this needle going anywhere else. Quick poke, quick poke. Ready? Take a deep breath. Inhale, exhale. This is the worst part. It's gonna go by super fast. By the time you say, ouch, it hurts, it's done. Don't move. Here we go. 1, 2, 3. That's it. Super fast. Here comes the second one. Don't move. Here we go. 1, 2, 3. That's it. You did it. The right side is all done. Now we're gonna do the left side. All right, Joe. We're almost done with this phase. You have super awesome, healthy skin. We also decided to do PRP for Joe. So Floor is going to harvest 35 cc's of whole blood. It's going to spin for 14 minutes, and then we're going to do PRP for Joe as well. The benefit of PRP is going to be, it's going to help him for faster recovery, sooner growth, and also it helps with the higher survival rate, survivability of the graft as well. Going to be completely numb. You shouldn't feel a thing. How's it going so far, Joe?
No pain.
You're good?
Yep.
Awesome. Except for the eyebrow pokes, right?
Yeah, that's, I mean,
That was
that's a
worth
given.
it?
That's a given, but yeah, that kind of like set the tone for the no pain right here. So.
But this looks amazing. This looks super awesome.
Nice straight arm for me, okay?
By the way, I have to say, everybody here is fantastic. They walk you through the whole process. I mean, you know what you're getting, or when they're gonna give it to you. So
No surprises,
kudos,
right?
no surprises. Yeah.
All right. Who paid you to say that?
Nobody's actually honest.
All right. We're going to do this left side.
more. Columbus Metro PA.
All right, Joe, congratulations. You did it, fantastic. How was it?
It's good actually. I mean,
Good?
Good.
You watching a movie, kicking back?
Yeah, kicking back and
Was it better than you thought or worse than you thought?
it's actually something new. I haven't done something like this before, but it's painless. I can tell you that.
Ah, good. Except for the few seconds of pokes,
Only
right?
in the beginning, yeah, the beginning, and then after that, you just don't feel anything.
All right, good. So you haven't seen it yet?
Seen?
What we did?
No.
All
I
right.
have an idea because you drew it. You know.
Yeah, you haven't seen it after the design, right?
No, I have not seen it after.
All right. Keep your head, no pressure. Drop your head back. Drop your head back. Let the chair do all the work. All right. So almost all of your 3,200 grafts
Yeah.
went into your zone 1 and zone 2. No touching, okay?
Okay.
After you leave our office for the next 28 days.
What if it itches?
No touching.
No touching.
So keep in mind, Joe, whatever you see right now in the mirror, it's
Yeah.
swollen.
Okay, I see.
This isn't going to be the final placement.
Alright.
Love it. I think it looks very good. Here's a mirror.
Okay. So all the red is gonna be hair, basically.
All of this is going to come down next few days.
Okay.
Okay?
Alright.
Right now you have about 30-40 cc's of fluid, liquid, in your scalp. That's going to cause your face to swell up the next few days.
Okay. And if it bleeds or anything like that,
It should stop.
Just okay.
Yeah. Shouldn't really
Okay.
have too much bleeding. What do you think?
Looks great, man. Thank
Looks
you.
good? There,
Looks
you can't
good.
really tell because
No, I mean
It's gonna
the
take
red
time.
The red area is gonna go away, of course, and then that whole.
yes, exactly. Be patient.
Okay.
3 to 4 months.
Okay.
All of this is gonna fall off.
Okay.
First several weeks to the first 1 month.
Okay.
Nothing to see for the first 3 to 4 months. After 3 or 4 months, you're gonna get about 10 to 15% growth.
Okay.
Okay. The hairline right now is too high because of all the injections we did.
Okay.
It's gonna come down the face this way and this way as well.
I
So
see.
about 1 or 2 fingers.
Okay.
Okay. And that's what's gonna cause your face to swell up.
All right.
Sounds good?
Sounds great.
You did fantastic, Joe. Thank you for having your procedure with us, and I
Thanks,
look
man.
forward
I
to
really
seeing your
appreciate it.
outcome.
Of course.
And I have to say,